So this is a blood vessel from a man who died due to myocardial infarctions. So if you can see under low power, this is 4-time magnifications of his coronary artery. You can see that the coronary artery is being affected by the atherosclerotic formation. So you can see the atherosclerosis is formed in this side of the vessels. So it compressed the lumen on one side. So the lumen is left with around 20% of the its opening. So this can cause blood flow limitations to the distal part of the vessels. So you can see if we magnify the images, sorry, it's a little bit blur. So bear in mind that this is a 4-time magnification that we enlarge. So it's a bit blur. So but despite, you can see, you can demonstrate that this is the fibrous cap of the atherosclerotic plaque. This is the necrotic center, and this is the unaffected blood vessels. So if you take a closer look, so you can still demonstrate there's some smooth muscles. Don't worry, this image is a bit blurry, but I will I will continue with a clearer image afterwards. Right. So this, you can see the bluish part here. Is actually the calcifications that occur in the necrotic center of the atherosclerotic plaque. Here, if you can see a few nerve innervation of the artery that supplies the artery and control relaxation of the smooth muscle and also contraction of the smooth muscle that alter the size of the lumen of the blood vessels. Right. So these are a bit clearer images of the vessels. So by taking around 252 fields of images and stitching it together using some software, so I managed to come up with an image like this. So it's a bit clearer. So just to demonstrate to all you guys, this is 40 times magnifications compared to the previous image, which is just 40 times magnifications. So under this images, you can see clearly the vessel's wall. So we take a look at the normal vessel's wall first, in which this part over here, you can see streaming from up to the down part over here. This is the smooth muscle layer or the tunica media. So inside here is a lot of smooth muscles that control the contractions and also the relaxation of the vessel's wall that alter the size of the lumen. So on top of here, which is toward the lumen, so this is the lumen. Towards the lumen here is the tunica intima, which is going towards the lumen. So these contain the endothelial cells that line the vessel's wall that are facing toward the lumen, and inside here there's a lot of connective tissue. So here is a small atherosclerotic plaque, or we can say a fatty streak that occur on this side of vessel's wall. Right. So this is how atherosclerotic starts, and then when the macrophages accumulate in um in a large amount under this fatty streak, so we can eventually become the atherosclerotic plaque, like in this part over here. So just to demonstrate what is atherosclerotic plaque, how does atherosclerotic plaque looks like under a microscope or histopathologically? So you can see this is a fibrous cap. This is the fibrous cap of the atherosclerosis. So it is actually arising from the vessels wall that are lined over here. Then because of the production of this necrotic center over here that are made up of macrophages and also small muscles that migrate into the tunica intima. So as the macrophages and also small muscle engulf all the circulating lipids that are present in the lumen here, so it become bigger and causing this part over here to be pushed towards the other sides and causing the narrowing of the lumen. So again, this is a fibrous cap. You can see there's a lot of empty spaces over here and some empty space over here and also over here. So all of these empty spaces are actually filled with the cholesterol and also lipids within it. All right. So if you take a closer look, this is a necrotic center that contains a lot of necrotic debris, cellular debris, and so some calcification which occur due to the necrotic processes. So all of this bluish and purplish kind of a color is actually the necrotic part, calcification that occur due to the necrosis of the tissue. So you can see empty spaces here. Again, I mentioned that it is previously actually is filled with the lipid and also cholesterol, with some of it appear to be sharper looking, like this one, and also this one. So all of this sharper kind or tapered end of spaces over here is actually filled by the cholesterol, and that's the name we call it, the cholesterol cleft. So you make a cleft that in which previously in living individuals it is filled with cholesterol. All right, by that I think that's the some summary of the how does atherosclerotic plaque looks like, and see you in the next video.